Wellness Health Services Health Talks. I'm Dr. Joshua Dirito, a family physician. I have an interest in public health, cancer prevention, and treatment. In this video, we are going to look at the future of telemedicine. What is telemedicine? Why is it important? And how does it influence our healthcare today? What are some of the issues with telemedicine? In the early beginning, it was just a telephone consultation. After the COVID pandemic, there has been rise in the video consultations, and thus patients are consulted at the comfort of their home. So there has been integration of telemedicine and the video consultation to the electronic health records. This has markedly expanded after the COVID-19. So what are the technologies that are shaping telemedicine? There is artificial intelligence. We have AI-powered diagnostics and also chatbots, which can help patients to communicate with their health providers and be able to provide their data or be able to ask questions that are related to their health. Then there is the wearable devices, which is continuous remote monitoring. You have patients who have blood pressure machines. They can be able to monitor their oxygen saturation. They can also monitor their heart rates, and this information can be relayed to their doctors, and then the steps to be taken can be relayed back. Then of course we cannot talk about telemedicine without the 5G connectivity, which helps the information to be relayed between the patients and the health providers. And the connectivity has to be at the patient point and also at the health provider's point. So this leads to faster and more reliable consultations because you can be able to communicate without hindrances. Then there is the issue of cloud computing, where the secure storage and the easy data access. Whatever data that is provided by the wearables that you have can be related to electronic health records, which can then be accessed by your health provider, and then there is communication, and the steps can be taken to influence and change your health. Then the blockchain has enhanced security for patient data, so that the issues of privacy are not as much because there is data security, and only the designated persons can access the data of the patient. So what are the benefits of the telemedicine? One, there is increased accessibility to healthcare. Patients and the health providers can be able to access each other without barriers, and the need for traveling to the doctor's waiting room may not be necessary for some condition, and especially for some of the follow-ups of the patients who have been seen by the doctors. And this takes care of waiting time, traveling challenges, and it also reduces the issue of cost. Then being able to be seen at the comfort of your home also reduces the cost and reduces traveling, and it also saves the doctor's time because they also don't have, they can see you at any locality as far as there is connectivity. Then there is convenience for the patients and the doctors because each person is at his point of convenience. There is improved patient monitoring and follow-ups, especially when patients have the wearables which can monitor their blood pressure, monitor their blood sugar, monitor their oxygen saturation, and this can be relayed back to their health providers, and they can be able to make the necessary adjustment, and they also provide the necessary adjustment to medications, and also advise the patients appropriately. Issues of counseling can be done through telemedicine, and also things like nutritional counseling, which make it easier for patients to be able to access healthcare at different aspects. Then there is also reduced hospital overcrowding because not all the patients have to come to the health facility. Then there is also on the issue of accessibility. Specialist healthcare can be provided to remote patients using the digital connections. So these are some of the benefits of telemedicine. So what are some of the challenges that we face with this telemedicine technology? The digital divide, there is still internet access challenges, especially in rural places and in low and middle income countries. The issue of connectivity and reliability of the connectivity is still a challenge. There's the issue of data privacy and the security concern. There's always the issue of who can access your data and what might they use it for. So those are challenges that we face. Licensing and regulatory handles. Still, the regulatory bodies have not completely embraced these telemedicine issues. There are still some regulatory issues that need to be sorted out. The issues of the healthcare providers reimbursement. How is telemedicine consultation supposed to be reimbursed? Is it like the normal office consultations, or how is it going to be compensated? Then there's a need for physical examination for some cases, especially for patients whom we have not seen before. Sometimes you may have the challenges of knowing exactly what is the exact problem, that we may have to have the patient physically for you to be able to examine him. Then there is the issue of resistance to change among the healthcare providers. Always change comes with its own challenges, and it is not always embraced at a first glance. So we still have some health providers who have not completely embraced this issue of telemedicine. So what is the role of telemedicine in specialized care? We have teleoncology, where you have telemedicine oncology consultation or cancer consultation, whereby you can have inter-provider consultations with specialists who are far off and can give guidance to the general care doctors on a day-to-day basis on the patient's progress, and if the patients who have been on cancer treatment have developed complication. Then you have telepsychiatry, where mental health support via video calls can be provided. We have teledermatology, where you have remote skin consultations using images, and this can also be either from dermatologists to general health providers, and then to patients, or from dermatologists to the dermatologist. Then you have telecardiology, where is remote heart monitoring with the wearables, and this information can be relayed to the cardiologist, and then they can be able to advise as appropriate. Then there is the integration of telemedicine with the traditional healthcare. Usually, sometimes we have hybrid healthcare models, in person and the virtual care, especially for patients whom the healthcare provider has not been able to see before, and there is need for physical examination. Then what is the role of telemedicine in emergency care? Would it lead to issues of delayed care? And also there is importance of collaboration between telehealth and the local clinics, the local labs, the local pharmacies, so that if patients have been seen through the telemedicine channels, they can be able to access their labs at a place of their convenience, and also access the drugs from the local pharmacies, or even other aspects that may need to be sorted out within physical access of the patients. So what are the future trends in telemedicine that we expect? One, we see AI-driven virtual doctors. We have talked about in some previous videos of the chatbot, which can answer patients' questions and also help book patients' appointment when there is a need to have the patient physically seen, or have physical consultation, have a tele consultation with a doctor, when the chatbot can be able to interpret the data the patient is presenting and present it to the healthcare provider. Then there's the virtual reality consultation. We also have expansion of the home-based healthcare solution, where patients can be seen at the comfort of their home, and this will improve the healthcare provision. Then more government regulations and support. This is a new area. We need more policies, more guidelines, more regulations so that this arm of healthcare develops as the normal healthcare profession, and there is greater insurance coverage for teleservices so that doctors and the healthcare providers can be reimbursed after providing the telemedicine care. So telemedicine is changing the field of healthcare. It has its advantages, which is making accessibility of healthcare to patients more available. Of course, there are issues of connectivity that are still a challenge. With the development of AI, there is likely that telemedicine will shape the future of healthcare, and it is important that we also embrace this telehealth innovation and as wellness health services. We are thinking of how we can dive into this mode of healthcare so that our patients can be able to access care without having to come physically to the health facility. So share your comments about what your feelings about telemedicine, how it has helped you, what challenges have you had, and what has been your experiences with the telemedicine. Remember to follow our overall channel for more content. Thank you for watching.